Hello, we're going to talk about treatment resistance or difficult to treat depression. Depression is a heterogeneous presentation. It looks like from DSM-4 like a one diagnosis, but within that diagnosis we have different underlying factors, different underlying genetic and clinical presentations, and different symptoms, especially when we look at combination of symptoms that dominates in a particular person, in a patient, can differ. So anhedonia, that has been a major symptom that comes up. In some patients, along with depression, we see issues with anxiety, and then in some others, we all see deficiencies in cognition, in short-term memory, working memory, and also attention span. So the comorbid features, especially anxiety, insomnia, sometimes substance abuse, sleep issues, and pain can be a big part. We also have to look into some underlying factors as our patients grow through their life. If they have been exposed to trauma, studies have shown that treatment of depression is more difficult if we have associated trauma, especially in the childhood. And that's why it's very important to focus on trauma and some of the mixed features. One important part of treatment of depression is to look at bipolarity, to look into if there is any bipolar symptoms that predominate in a person, especially when we have first-line treatments like serotonin-specific reuptake inhibitors that are not working. So three main factors that we have to look into when we try to treat depression. First is the biological factors, and this could be part of the impaired neuroplasticity, genetics, sleep architecture, and dysregulated HPA, hypothalamic pituitary axis. Then we have psychological factors where we have symptoms of anhedonia, also difficulty with cognition, and then emotional blunting. That's a part of the biological and psychological factors. Then obviously the societal factors that comes up is level of functional impairment, impairment at home, impairment at work, and that leads on to dysfunction and difficulty. And this may also lead on to elevated suicide risk, especially when we don't have a good response. So depression is not the same. It may be lumped under major depressive disorder, but it has different. So now we are moving from neurotransmitters to circuit level dysfunction. That's what we're going to talk about next.